Welcome, everybody. Welcome this morning. I'm really excited about talking about the pelvic floor today. I just wanted to explain, first of all, what inspired this interview. Um, Lisa, you may know, and I know that the rest of you know that I'm a wellness instructor, I'm a yoga teacher, and I've created a couple different digital programs. Most of my clients are women, and I realized as I was creating the 14-day core challenge, I had to acknowledge the pelvic floor. Now, as a yoga instructor, and I know we're going to have another yoga instructor possibly in here on the Zoom meeting today, we learn about the pelvic floor, kind of. We learn about breath work, we learn about the diaphragmatic breath and relaxing the pelvic floor. But it's kind of like one of those things where the more you know, the more you realize that you don't know. So um, I decided I need to reach out to an expert about the pelvic floor. So I'm really excited about speaking with and interviewing Lisa Gramlich. Am I pronouncing that right?
Correct.
All right. So you are the current lead PT for Middlesex Health. Um, PHIT, Pelvic Health and Incontinence Training Program. All right, and we have a bunch of questions for you. I'm gonna just list the questions and then you can just dig on into it. Does that sound
The
okay?
patient, just to give some background, I went to Quinnipiac. I got a traditional PT degree. I'm also a certified integrative manual therapist, which means I went to school up in Bloomfield at the Center for Integrative Manual Therapy. And really, it changed my life. I had a daughter who was at the time 7, who was diagnosed with ADD, who just really was having issues educationally. And I played soccer with a woman who worked up there, who was another PT, who basically was like, would you be willing to try alternative medicine? And that was my first foot in the door to alternative holistic care. So I trained there for 3 years, and that's basically healing with your hands. And then, due to some life changes and marital changes, I found my way to Middlesex, and I was doing acute care, hospital based care. And at the same time, prior to that, I had a private practice. And then a colleague approached me about pelvic health and said, I think you'd be great in the pelvic health realm um, doing pelvic health. So I shadowed with her. Then I started taking a bunch of classes, and that was about 5.5 years ago. And here we are today.
That's an awesome intro. Thank you so much. That gives us a lot more background into who you are and what brought you where you are now. Yeah, I love the idea of you um, having the opportunity to educate others that just sit next to you. They can,
Y-
you know.
Well, and I think the pelvic health, as we all know, is a very spiritual, emotional, and physical part of our body. And that goes for men as well.
Mhm.
So to just say I'm a PT and we're going to give you some of these exercises is not what I do. Um, I really look at somebody holistically, and we're looking at what's going on in all parts of their body, not just in the pelvis.
Absolutely. Absolutely. Great. Um, okay. So Lisa, you had the questions that I gave you. I got a lot of those questions from my clients and my students. How about you start wherever you would like to start?
Sure. So usually the first question, when someone comes in to see us, we do a thorough intake. So we ask you about um, pregnancy history and sexual function and bowel function and urinary history. And we ask all about that because that's going to tell us, obviously, about your story and help us to figure out what's going on with you. So, in general, again, this is, everything condensed into a short interview. So, we're going to touch on some of the basic concepts. And then, if people have questions at the end. So, what is the pelvic floor? What does it do? Why is it important? So, how I describe it to people, and I apologize, I meant to grab my female pelvis when I left the office yesterday. I didn't. But if you think about the two hip bones, that you have that we put our kids on, right, that sit up on our hip bones, and
Mhm.
then, you have your two upper leg bones. The pelvic floor is essentially a hammock that is going from hip bone to hip bone. Okay. So the thing that's so important about it is that it stabilizes the pelvis so we can move and run and function and we don't fall down. So it creates balance. Um, and then it also holds up our uterus and our colon and our bladder and all of those organs up above. So it's now a support mechanism for those, as well as two of the pelvic floor muscles come out and attach to those upper leg bones, and they rotate the hips in and out. So you have a pelvic floor that, you know, Dr. Kegel, a long time ago, who got named the Kegel, he thought there was one pelvic floor muscle, and that's not the case. We have this whole hammock of muscles that stabilize, support, and rotate the hips. So just thinking about that, you can think that you can imagine how much can go wrong over time with hormones and babies and all of the things that happen and any trauma that occurs to the pelvis. So the next thing I would say is that you need to understand is that there's 3 layers of the pelvic floor. So that first outer layer is now I'm going to speak in frank terms because I'm, as my kids say, I'm pro sex, pro woman, pro health, pro name your parts, right?
That's right.
So the first layer is all about underneath where the labia are, the clitoris. That's sort of where your first layer lies. Not sort of, but it is. And then underneath that, there's a second layer that runs from the anus underneath that first layer. And then you have a third inner layer that sits inside the pelvis, and that's your deepest innermost layer. So if you can think about 3 layers, one on top of the other, creating this hammock, that's 12 muscles, actually, not one, as Dr. Kegel thought, but 12. And so it's a huge piece of real estate in the body that I feel like no one's talking about. We're talking about it, but a lot of people, it's sort of a gray area. They don't really know what it is and how it works. You know, it's more muscles than in probably any other part in the body, if you think about it. So that's the importance of the pelvic floor. So part of that anatomy that it's important for you guys to know as well is that the bladder sits in there.
Yeah.
So depending on how weak your pelvic floor is, okay, so if it's sagging, that's going to change bladder position. If you have a pelvic floor, though, that's really super tight, that's like a trampoline, then that's a problem as well. So how I describe it is if you ever sat in a hammock on a beautiful sunny day, if you go to sit down in the hammock and it's not tight enough, your butt will hit the ground. You go to sit in it, your butt hits the ground, you got to get out, you got to reattach it. If you go to sit down in the hammock and it's too high, you can't get your bum over the top of the hammock. You want a hammock that essentially is just right. So you can get in it, it can support you, you can lay down, you can be comfortable, right? So that's the hammock principle. So women can come in with a really weak pelvic floor, or they can come in with a really tight pelvic floor, meaning the tone is really high, that hammock is really taut, or you can actually come in with a combination of both issues. And just as a disclaimer, men have a pelvic floor too. I do treat men, women. We do have a pediatric program, and our men, unfortunately, are some of the most underserved because we have a gynecologist to go talk to. They really don't. They'd have to find a urologist. So pelvic floor exists in men and women. Some of that layer 1 is a little bit different, but really layer 2 and 3 are similar, just so if you're thinking about the anatomy. So we have the bladder that sits in there. It's affected by position of pelvic floor. If it's too tight or too weak, that's going to change bladder position, and that may lead you to issues of incontinence or leaking. You know, or difficulty urinating. Some people come in, they're not able to urinate or they can't start their flow. Generally speaking, you should be able to drink 6 to 8 cups of water. Now, I've changed my thinking a little in that if you do the math and you take half of your body weight, that's generally what we say within our practice. That would be your maximum amount of water. So if I have a 200-pound FBI agent, 100 ounces would technically be his high end for the day. And that's way more than 8 cups a day. I couldn't clinically say drink more than 100 ounces because when you drink more than half your body weight, you can change what's going on in your cells in terms of potassium and sodium. And so that's out of our scope of practice. Some patients come in to see me and they're going to have bariatric surgery, or they've had bariatric surgery for weight loss. They're under a physician guided water consumption that's more than half their body weight. So what I say to people is think about today what your body weight is, take half of that, and that could be your maximum amount for the day. So when I'm saying to you, oh, drink 6 to 8 cups of water, 8 cups may not even be near your maximum amount for the day. So the bare minimum, even for my 17-year-old, I say to her, for the minimum amount of water per day would be 4 cups of water, or 32 ounces. And why is that important? It's important because the bladder is a muscle, and it's a muscle that should stretch and expand and hold urine during the day. It is affected by dehydration or lack of adequate hydration. So the first thing people think of is I'm leaking or I'm going off and I'm just going to stop drinking. That's actually the opposite thing that you want to do. You want to adequately hydrate, not only for immune function, right? Living in an era of COVID. You want to hydrate so that the mitochondria and the cells are working to fight off infection, and that happens at a cellular level. So you want to make sure that you're adequately hydrated, but also so the bladder can stretch and expand and hold urine. Having said that, you should be able to drink at least 6 to 8 cups a day and go to the bathroom in terms of urination every 3 to 4 hours. That's healthy. So when I'm at the hospital here and I have nurses who tell me they have an iron bladder and they only need to go once a shift or they don't go at all, that's actually not great for your bladder. Now you're overstretching your bladder and you're creating another type of problem. So remember, kidneys and ureters and bladder detox our body. And if we're into holistic health and healing, we want toxins in, we want toxins out. We try to limit the toxins that we take in, but we want to flush our system. So you should be drinking that 6 to 8 cups of water, and you should actually have to go every 3 to 4 hours. I have some people that come in again, they go every hour, every 30 minutes, or they're going every 7 hours. And so your bladder should stretch, fill, empty. Stretch, fill, empty. It shouldn't be fill a little, pee a little, fill a little, pee a little, because that just sets you up for problems down the road. So the other thing that we don't want you to do is JIC, which is called just in case. So JIC is jicking, just in casing. We all do it. We teach our kids to do it when we're potty training them. I mean, really by the age of 4, the average child should be able to be drinking and holding an adequate amount of urine. So I know I'm guilty before we leave the house. Even still today, I have 3 kids, 27, 23, and 17. I'll say to my 17-year-old, I'll almost catch myself saying, do you need to go to the bathroom? Because that's what we do. But we really want to go when we have to go, not because we're thinking about going just in case. Now, clearly, if you're getting in a car and you're going to go on a 4-hour road trip, you may go in and use the bathroom. But generally speaking, you shouldn't have to go if you're just going to the grocery store or, out to a doctor's visit. You would keep a mental note of when you go to the bathroom. So 3 to 4 hours is the accepted goal, is what I would say about that. If there's any questions at any time, I don't know how you want to do it, Julie, at the end, and people keep track.
You know what? I mean, we have a few people, so if you guys have any questions, you can go ahead and open up the chat and just put it in the chat box. And if anything comes up, and I feel like it's good timing, we'll just I'll throw that question out to you. Okay. So
Okay.
Lisa, you don't have to watch the chat box at all. I got that.
Perfect. That's awesome. Thank you so much.
Yeah, sure.
Okay. So what are signs of pelvic floor problems? So there's many, and so I don't forget them. I'm just gonna, here we got one. Do you want me to wait till I'm done?
Yeah, why don't you wait till you're done,
Okay.
and then we can get to that. These are great questions. I knew I was gonna have great questions from you guys.
Okay, so in terms of issues that are related to the pelvic floor, I made a list, so you're going to see me looking at it because there's so many, I don't want to forget one. Leaking or incontinence, okay, so both mean the same thing, of urine or stool. Urinary urgency, meaning get out of my way, I have to go to the bathroom. Or frequency, meaning more than every 3 hours you're going to the bathroom to urinate. Constipation is another sign of pelvic floor problems.
Mhm.
Pain with intimacy, anorgasmia, meaning you can't have an orgasm, or pain with orgasm, chronic UTIs or bladder infections or UTI like symptoms, the feeling of falling out down there, you feel like something's going to fall out the vagina, chronic low back pain. That's a huge one. I can't tell you how many people have come in with chronic low back pain for years. Now, if you guys can remember the hammock, if that hammock is sagging, what's going to pick up the pace? The low back muscles. They're going to kick in and overfire to try to compensate for this sagging pelvic floor. We strengthen the pelvic floor, low back pain goes away because they're not overworking. It's one of the, I had a woman who came in, she was seeing a traditional PT for 8 years. She came into me because she was leaking. And so we went through the whole pelvic floor program, and her 8 out of 10 back pain that occurred daily that she was having PT for the last 8 years went to zero. And so what happened was she went back to her traditional PT and said, hey, look what I just did. And the funny thing was we offered a pelvic health class for PTs, and that PT was in the pelvic health class learning about pelvic floor therapy because it had helped her patient after all these years. So definitely chronic low back pain, abdominal pain of any kind that they haven't found a medical reason for, that can be due to the pelvic floor, pubic bone pain, hip pain, pregnancy induced pain, especially during pregnancy with hormones, that can be a sign of, hormones and instability and orthopedic problems as well as pelvic floor problems. If you had a traumatic delivery, you pushed for a really long time, you tore, you're not feeling the same after delivery, that's a reason to seek a pelvic floor evaluation. Again, any postpartum issues that don't resolve or new issues that you didn't have before. We also see women pre-op hysterectomies. So we prepare their pelvic floor, treat any problems that we find, and then post-op, we actually see them again, which is a really wonderful way to have a holistic approach to hysterectomy. We see men pre and post prostatectomy, but the funny thing is we have a protocol for that here, but out there, there's not a lot of referrals for the pre and post-op hysterectomy, which kind of is interesting because the prostate and the uterus are, the compatible organs in males and females. But for men, we have a full-blown pre and post prostatectomy program, but hysterectomy isn't sort of there yet,
Oh my gosh.
which is, so you all, if you find someone who's going to have a hysterectomy, which you will, you
Yeah.
can say to them, there is an option for you. And the thing is, when I treat people and I talk to people, I say, you don't need to come see me. But when you get treated and you're better, you pay it forward and you help someone else. And that's how we keep this going so that we have the opportunities to get better, right? Okay, so I don't know if you want me to jump in with questions.
We do have some questions here. Um, do you see the chat, Lisa?
Let me open it up here. I know there's 6.
Because then you can choose.
Okay, so we'll just go through these. And again, some of this has to be specific to you and your issues, and we come in and we figure that out. So what about overactive bladder? Yep, that's an issue. We do have a urologist that we work closely with who will see women who are diagnosed with an overactive bladder. We treat it. And again, there's usually other issues related to that, okay? People come in all the time with overactive bladder. What does that mean? Is that a generic term? Is your physician giving you that diagnosis because it's what it sounds like it is? Usually there's multiple factors to overactive bladder. We figure out what those are. There's a whole list of bowel and bladder irritants that people don't actually understand. And what I'll do is just segue for a second on that. So there are 5 major bowel and bladder irritants. Those include caffeinated and decaf tea and coffee. That includes chocolate, that includes alcohol, that includes citrus fruits, and that includes bubbly water or anything with carbonation, which would be tonic water or soda. So people come in drinking they're like, I drink 8 cups of water a day, but it's bubbly water, and they can't figure out why they have an overactive bladder. So irritants, lack of hydration, and pelvic floor problems can lead to overactive bladder. So you have to figure out the thing I love about my job is it's not boring and it's not textbook. You have to figure out for each person what elements need to be treated in order to get that person better. So how does constipation relate to pelvic floor health? That one is actually really easy because you have that pelvic floor and you actually have the colon comes up, goes across, comes down, and then goes out. So if you have pelvic floor dysfunction, too weak, too tight, if you've had any surgeries, that could be any type of surgery in the pelvic floor and you have scar tissue, that colon is not having the peristalsis that it needs to move your bowel movement along. So we have a whole program for constipation. We teach you colon massage. We talk about diet. I have had people coming in I had a woman who was 75. She had a bowel movement once a week since the age of 5. And when she was done with me, she was pooping every day, soft bananas, and was going to talk to her doctor about coming off her medication. So definitely is treatable. 100%, I want to say we can get you better from where you are, and especially in kids. So we have a pediatric program and we're treating incontinence in kids and constipation in kids and starting early. Hemorrhoids in the pelvic floor, I used to think if you were constipated and you did strain, you're more apt to hemorrhoids. So if we strengthen the pelvic floor and we address any abnormal tone and we help you with the constipation, hemorrhoids would resolve. And I think that's still true, but there are people who come in and they're like, I've never strained my whole life and I have hemorrhoids. And I was actually just talking to a vascular PA the other day saying, is there a link between like varicose veins in the legs and more risk of hemorrhoids? And she wasn't actually really sure. So I only answer what I know. I'm finding that people who are constipated, who strain to go to the bathroom, have more hemorrhoids. But then again, I've also seen people who don't strain at all who have hemorrhoids. And I don't know if there's a genetic piece to that part. Do they sometimes come together? Yes, I just answered that. Constipation and hemorrhoids, yes, for sure. C-sections, yes. So C-sections can damage the pelvic floor. We thought for years that having a C-section supposedly saved the pelvic floor. Now we know when they cut through the layers, through the abdomen and down to the uterus, that there is a nerve in that area that actually innervates the pelvic floor that is often can be damaged during a C-section. So now we don't say that anymore. We absolutely say if you've had a C-section, you can have issues after with your pelvic floor because of the nerve function that runs through that area where they generally are making the incisions to deliver the baby.
Wow. Quick question, Lisa. What nerve
Yep.
is that? Do you know?
I'm drawing a blank. It's like the iliohypoglossal, I believe is what it is. It's usually a mouthful, but I believe it's that one, iliohypoglossal. Is that what they cut when they go down?
All right.
Yeah.
Wow.
And so the next question, what are some therapies that can help? And should we try these prior to coming to a practitioner? I think diet, I think hydration and I think watching bladder irritants can be helpful. But often if when I read through these questions on the next section, if you're answering yes to more than one of them, it may benefit you and you've had kids and you've had constipation and you have pain with sex, it may behoove you to have a screening. And most insurances, we haven't had one insurance that doesn't pay for pelvic health PT. Some of them will authorize 10 visits. Some of them only authorize 4, and then we have to do a reeval. But it's being paid for because it's so successful. On average, 7.2 visits, we have people better. Now, that means sometimes people come in for 6 and they may need 13, depending on how many things I'm treating. But on average, 7 visits once a week is usually people are seeing results and are better. So I am taking patients. Middlesex Hospital, I'm just going to give a little shout out to my coworkers if they're ever listening. So we have, I think it's 10 now, pelvic health therapists, including 1 pediatric pelvic health therapist. We have offices in Middletown, Essex, Marlborough, and I'm in Madison. We are one of the only places, I believe, in the state of Connecticut that has an actual program and a team. Like our department is dedicated to this program. Other facilities, from what I can understand, have 1 therapist. Some therapists only treat women. All of our therapists treat both. So we treat men and women. And again, we have the pediatric population. The only thing you need, we require a script from some type of medical practitioner, just so that when we do your eval, there's some type of correspondence going back and forth in case there's something we need to discuss with them medically. Can reoccurring bacterial vaginosis be a sign of pelvic floor inflammation? I'm going to hold that one to the end because that's a whole nother topic that I'm absolutely fascinated about
Yes.
in terms of pelvic floor pH and the vaginal microbiome, which is new and cutting edge. So I'll talk about that at the very end. Can stress cause problems with the pelvic floor? Absolutely. Not lifting properly. I can't tell you how many people who do CrossFit who come into me with major pelvic floor issues
Oh, yeah.
and prolapse. And I'm not saying I'm anti-exercise. I'm anti-people teaching CrossFit to other women
Yeah.
who do not understand the pelvic floor.
Mhm.
One of my coworkers, he's a big burly OT. He tells me that they're pee pads, there's
Yep.
CrossFit pee pads,
Mhm.
and that women are cheered on when they poop or pee while
Yep.
they're lifting these heavy weights. And he didn't know that was wrong.
Yep.
So that is wrong. You should never be incontinent of anything when you are performing an exercise. That is a sign of an overload on the pelvic floor. And when you're doing those type of activities, you are pulling organs down and out because the force has to go somewhere.
Right.
And these weight belts that women wear, there was a whole article done by a pelvic health PT, the weight belts that people will use like men do around their waist actually creates more force down and out through the vagina. So that is not something that we recommend. So that's a piece on that part. Body alignment. Of course, if you have some orthopedic issues that are underlying, we have to address those too. So I specialize in the pelvic floor. I'm also a PT. I'm not going to sit here and say I'm a sports medicine specialized PT because that would be lying. But I do get my pregnant women who are runners. We fix their pelvic floor. I'll get the pelvic floor in check. And then often my patients, not often, but sometimes I'll refer them to my PT in the office who does a lot with running and more specific orthopedic related issues. It's wonderful. We have a setup with our team where we can even if I think you have an issue that may be more orthopedic, I just set up a treatment session with my colleague who's orthopedics in the sessions that we're having to figure out and screen you. So it's a really nice setup we have in terms of a team approach. And I sit at the computer a lot. How often should I take a break to help my pelvic floor? I think sitting and standing is a good thing. I don't think anyone should stand all day. Gravity is pulling down on you. So when you have women who are nurses or who stand all day long, gravity is pulling down on your pelvic floor all day long. I think it's good to vary your activity if you can from sitting to standing. So having said that, I'm just going to move on to the next session. How do I know if I have pelvic floor issues? So this is really important. So these are questions that we have on our Middlesex Health website we have a brochure that we'll give out to patients, but there is a link to this, I believe, on our website. Do you leak when you stand up, when you cough, when you laugh, or when you sneeze? Or do you leak after meals? This is the bladder. Do you have an uncomfortable urge to urinate? Do you wear a pad just in case? Do you get up at night more than 1 to 2 times to go to the bathroom? Do you feel your bladder is never quite empty? Do you feel anxious about maybe not making it to the bathroom? You can't make it consistently 3 hours during the day between trips to the bathroom. We talked about that. Once you sit on the toilet, you can't urinate. Nothing comes out or it's delayed. That's a pelvic floor problem. Bowel questions. Do you leak feces when you stand up, when you cough, laugh, or sneeze? Do you push or strain to have a bowel movement? Do you have pain with bowel movements at any time, beginning, during, or at the end? Do you have more than 3 bowel movements per day? I see a lot of people who come in with Crohn's and colitis that they have it, but we actually improve their situation of their multiple bowel movements per day by addressing pelvic floor issues. Pelvic pain. Do you have rectal, vaginal, or any genital pain, numbness, or tingling at any time? Do you still have pain after a pelvic surgery that you have had, or childbirth or delivery? Okay. Um, so those are important questions to ask, and to just know that if you answered yes to any of those, that could mean that you need a pelvic floor evaluation. So what's a pelvic floor PT? I want to put this out there and just clarify. There's lots of people out there that are going to say that they do pelvic health. I've run into them myself. And so I very nicely will ask, oh, do you do an internal pelvic floor evaluation? No. Do you do biofeedback? No. Okay, so what do you do? Well, I do exercise and I do some visceral and some manual orthopedic stuff. Great. And that's fine. But in my realm and in our program, every patient gets, unless they refuse, which is fine, gets a external or outside pelvic floor evaluation, an internal pelvic floor evaluation, a thorough intake. They have biofeedback done that assesses pelvic floor tone. We teach mindfulness, we do exercise, we look at the orthopedic approach, and we address diet. So when you're looking to find someone, it's not against your, it's not rude to ask, what do you provide? I've had patients come in to see me who've had biofeedback and exercises, and they didn't need exercise because that made their problem worse. They needed to reduce their pelvic floor tone first before they started exercises, but they didn't get that. So then they come to see me and they're worse because they did C before they actually addressed B.
Right.
So just know, pelvic floor therapists do take specialized training. You can always go to a website called Herman and Wallace. Herman and Wallace is a website where we train and take our classes. It's one of the avenues. It began as the only avenue. On that website, there is a link to find a provider.
Mm-hmm.
So you can click on that link, even for family members in other states, and it will give you a list of providers that you can find. And again, I just talked about what do they do. There's a wide range. I'm skeptical if someone is just doing an intake and giving you a bunch of exercises. Now, having said that, if you come in and you're pregnant and you're really only having right SI joint pain, and you go to see somebody who specializes in pregnancy, and it's really an orthopedic issue, and they help you with that and you get better, that's great. If other things start to happen that aren't getting better, then maybe you actually need a pelvic floor therapist because there's more going on. And so what are a few simple things that you can do to ensure that you have a healthy pelvic floor? One is pay attention to your body. Most women are really in tune to parts of their body. If you think something's not right, it's okay to ask a question. You can also reach out to a pelvic floor PT. I have patients that I haven't even met yet who call and ask me questions and want to talk about the program and is this appropriate for them. You want to drink your water. 4 cups a day is the bare minimum. Half your body weight would be the maximum. Putting a slice of lemon in your water is actually really helpful. Lemon is acidic outside the body, it's alkalinic inside the body. So a slice of lemon in your water is actually really beneficial to the kidneys and the bladder. So I know some people hate water, but that's a way to get around it having no taste. Try not to strain with your bowel movements. Think about when you urinate and have a bowel movement, you're actually relaxing your pelvic floor. So here's a point to remember. When you sit on the toilet to go to the bathroom, the pelvic floor should go into a resting mode. That signals the bladder and the colon to contract and empty. If you have high pelvic floor tone and you can't relax those muscles, when you sit down on the toilet, you're going to strain to urinate and strain to have a bowel movement. And the only way to know that is through biofeedback. That's how we determine what your pelvic floor is doing. But you kind of know if you're straining with urination and straining with bowel movements, you're not supposed to push when you void. It should be actually a relaxation that occurs so that you can go to the bathroom. Make sure your feet are on the ground, especially for your kiddos. You want to have feet supported. If your feet are dangling, that actually activates the pelvic floor, which we just talked about. We want that to be off. So you always want a step stool under your feet if you're little and your feet don't reach the ground. We also incorporate squatty potties and things like that for constipation. And really watch your bowel and bladder irritants. And then what I'm going to just sort of finish off with, and I'll go back to the questions. So the vaginal microbiome, if you haven't been to this website, everybody write it down. Goodcleanlove.com is, I don't make any money. They don't even know I'm sitting here endorsing them. I just disclaimer, wonderful company founded by a woman who was having pain with sex, didn't find a product to help her, ended up forming this company called Good Clean Love. And we haven't touched too much on sex, but pain with sex is a huge problem. I'm very sex positive. You should be able to experience intimacy and sex in any way that you want, in any shape or form, as long, my motto is that it's not physically abusive. I see straight people, gay people, trans people, polyamorous people. I treat them all, and I don't care what people do in the privacy of their own bedroom, as long as they're not having pain from a pelvic floor problem and it's not abusive, right? So everyone is entitled to intimacy and pain-free sex and orgasm. And the more we talk about it, the more we'll become comfortable talking about it. But you want to get help because you shouldn't have to suffer. And I can't tell you how many women come in and they've been having pain for years. And when they finally have pain-free intimacy, it's just like, it's really gratifying because it's been something they haven't been able to enjoy for a really long time. And I feel like that's a right that everyone, and I treat men for testicular pain and pain with erection and orgasm and ejaculation too. But just know that that's not okay. You shouldn't have pain, and you should seek out someone to help you with pain. So having said that, Good Clean Love, great website. They also have a whole educational tab. Briefly about the vaginal microbiome. The vagina is the one area in the body that should be essentially acidic. So a woman's vaginal microbiome should be, the pH of a woman's vagina, should be 3.2 to 4.5. That's acidic. So if you know anything about when we were back in science, 7.0 is alkaline, above is neutral. Above 7.0, you get to be more alkaline. Below 7.0 is acidic. So a woman's vagina should be somewhere around 3.2 to 4.5. Why is that important? Because when it's acidic, it creates lactic acid. From lactic acid, you actually produce lactobacillus. And so the question is, where have we heard lactobacillus?
Probiotics.
So your vagina is so cool that it produces its own probiotic, lactobacillus. So what research is showing is that women who start to have BV, which I think it's 60% of women have at one point, or recurrent BV, or often pain with intimacy, or UTI or interstitial cystitis-like symptoms, I'm actually helping women address their vaginal microbiome on top of everything else I'm doing. And sometimes that's the one issue that starts to change things. So as we age, they think with hormone changes and maybe pregnancy and delivery, and depending on what's going on, that the vaginal microbiome may change and become more alkaline. Here's the really interesting thing. Menstrual blood, I believe, is 7.2, and sperm is 7.4. I'm close in that area. So if you have an IUD or you're on birth control and don't need to use a condom, and your spouse and you are having obviously sex without protection,
Mhm.
and you're noticing that after sex you're irritated, maybe your vaginal microbiome is 5.2. And now that 7.4 of sperm is driving you up higher. So during those times, you actually feel more irritated after sex. It's not actually that there's something wrong with your vagina.
Mhm.
In the same token, some women will be irritated at the end of their periods. Well, if blood is 7.2 to
Mhm.
7.4 and you're on the high side, that may be driving your pH up. So gut microbiome is huge because that's sits right in the same area if you think about the anus and the vagina. But the vaginal microbiome, we think, should be in this acidic range, and that there are women who have no problems who are like 5.5, and they're
Mhm.
studying that now to figure out why that is. But in general, what I'm finding, so Good Clean Love has this product called Balance Femwash. Balance Femwash, if you think about soaps that you use down there, they're alkaline. So Balance Femwash is a femwash that's created, you keep in your shower, that I use, my daughters use. I give it to my mother, my sister. It biomatches your pH to keep that pH in an acidic zone.
Mhm.
So I don't use soap there anymore. I use soap on my body, and then
Right.
I the balance there. They also have a new product out that has hyaluronic acid in it, which is very cool, which oncologists asked Good Clean Love to create this product for patients who have had breast cancer and chemo and uterine cancer because of dryness that occurs. I'm starting to wonder, I don't have any evidence on this, is that as women approach menopause, is it not a bad idea to do a few swipes of this product on your vagina after you shower a few times a week? Keeps the tissues plump, keeps them, soft, and prevents dryness. They also have a wonderful lubricant. Quick note on lubricant: you shouldn't have a lubricant that has methylparabens or glycols in it.
Mhm.
Glycols dry out the vagina. Methylparabens are pseudoestrogens, which are controversial at this time. So Good Clean Love does make a naked lubricant, which has nothing in it. And then, of course, the Balance Femwash. They have a Restore product. I talk to women about all of those. Technically, I'm not a physician. I don't prescribe, but we have a conversation. Um, and then women make the decision whether they want to use these products or not. So that's a quick summary of the pelvic floor,
Wow.
and all you need to know in a short amount of time.
Lisa, thank you so much. So just you were chock full of information. I'm going to put your contact out there. We had a question on the chat, can we talk? So,
I just want to look through this. So we talked about nutrition. Um, in terms of the right clothes for pelvic floor issues, I don't love thongs, and my kids have thongs. Thongs create tension and bacteria, but they create tension through the pelvic floor. I'm not a thong proponent. That doesn't mean I'm not going to tell you not to wear a thong.
mhm,
Um, the squatty potties are good. You can try them to raise your feet. If you raise your hips, your knees above your hips, that's the whole premise of the squatty potty. Opens up the colon, makes it easier to go. And coconut oil, we used to love it, but now what I'm reading is that coconut oil can change the vaginal microbiome. So if it works for you and you really like it, okay. But and I think 5 years ago we were like coconut oil, but now we're finding that coconut oil can actually change the vaginal microbiome. So, but I'm not going to tell you not to use it, but you may want to see how the Good Clean Love sensitive skin or the Good Clean Love naked lubricant works for you. And probiotics for the vagina, Good Clean Love now has a actual suppository, a vaginal suppository probiotic of lactobacillus. I try all the products. I have not tried that one yet, but I will be getting it because if I want to try them, if I'm going to give them to my patients, so they do make that, and that's just for overall pelvic floor health.
Great. And
Okay.
Lisa, quite selfishly, I'm going to ask a question about exercise and movement. There are a lot of, like I go to a fitness class and sometimes I see these exercises. I'm like, nobody should be doing. I know sit ups, crunches. Do you have any tips on um, pelvic floor exercises that are good? Maybe some that we should avoid, some things maybe we should bring attention to as we are lifting. I don't know. I'm just going to open that up there.
So I think, that's something obviously that would take more than 2
Right.
minutes to discuss. If
Sure.
you get in to see a pelvic floor therapist, we'll talk about their specific exercises we use, but
Mhm.
you need to be taken through them. In terms of lifting, so
Yes.
any rapid repetitive movement, so a kettlebell squat with a swing,
Mhm.
lifting heavy tires, um, those are going to create even sneezing and coughing creates a force in the body that goes down and out through the pelvic floor. So what we do is we teach you how to use, I'll call it a Kegel, but we are not all about the Kegel, so don't think that. We use the Kegel as one small part of our program,
Mhm.
but we teach you how to engage the pelvic floor properly when you're lifting. um, I don't love full-blown sit-ups. I think if you have diastasis recti, which is after delivery and you have an opening in the abdominals, you have to be careful with that. We
Mhm.
usually strengthen the pelvic floor first before we have people do those. But any type of rapid squatting or heavy lifting, just know that you're creating a force that's going down and out through the vagina. There is a website called Your Pace Yoga. Um, it's one of Dustian is a pelvic health PT who actually takes people through um, pelvic health safe yoga
Mhm.
that you can all look at as well. I'm sure you can Google pelvic floor exercises. I don't know what comes up on YouTube,
Yeah.
but you just want to be careful of any rapid type movements with lifting and squatting. We teach you to pull up and in on the pelvic
Yeah.
floor, but if you don't know how to do that, I can't tell you how many women don't know how to do it. They don't know how to do a Kegel. They have no idea what it is. They've been told to do it wrong.
Mhm.
And we would want to make sure that you can do it correctly.
Right on. All right. Wonderful. Okay, Lisa, thank you so much. We went over time a little bit, but
Sorry.
you really, no, we totally appreciate it. I think, I don't know, I just have to say thank you. Thank you all for coming on Zoom. We're getting some thank yous in the chat box. I'm going to post this on the Mountain View blog and on the Mountain View Facebook page. I'll make sure to tag you. Um,
Sure. And if you want to, I know we had talked about the sheet I had given you. If you want, I'd be okay with you taking the questions, the
mhm.
bladder and bowel and pelvic questions. If you want to actually post those, that would be a great way for people to ask themselves those questions and self-screen. Um,
Absolutely.
that would be wonderful. And again, you don't need to come see me. You don't need to come to Middlesex. Um, Find someone where you live that works for you, but ask questions about what they're doing so that you know you're getting a full comprehensive approach to pelvic health.
Awesome. Thank you
Thank you
so much.
guys.
No, thank you so much. You're really, really informative, and I think it's really important that we begin to have this conversation and stop making it so taboo.
And I
Um,
think if you know men out there who are leaking, who are constipated, who have pelvic pain, have them see a pelvic floor therapist because men need pelvic health too.
awesome. All right.
Okay, great. Thank you.
Thank you so much. Have a great day.